Now we have one more very interesting ECG. So when we try to find out, you can simply zoom in. You can simply try to find out what is the problem. You can simply pause the video and you can try to find out what is the problem in this ECG. So let's start. The first and most important thing is key. When we scroll in the ECG, we can see here it is very obvious that there are two P waves. So this is P wave for sure and this is P wave for sure. Now this is QRS complex, and before the QRS we have this P wave. The same pattern is followed everywhere. This is P wave, this is P wave, this is P wave, and this is P wave. Now one thing is for sure, that P wave morphology, means the P wave size shape, tells us whether the P wave is coming from the same focus of the sinoatrial node or from the atria, or it is coming from the different sinoatrial node or the different place from the sinoatrial node. So SA node normally it will have a particular typical morphology. Morphology means if the P wave is of this shape and size, then all the P waves will be of the same size. But suppose if we are getting two different P waves or three different P waves, so the P wave morphology may vary. So it may be like this and it may be like this. So these are two different P waves. It means okay, this P wave is coming from different place and this P wave is generated or coming from the different place. So if one P is like this and one P is like this, it means that these two P waves are coming from different places in the atrial pacemaker site. But in here the both P waves are almost of same size, same shape. It means that these are originated from the same place. So there are no two different foci. The focus of this atrial wave is same. So in short, here there are two P waves coming, means atria is firing two times in one impulse. So we'll simply calculate what is the heart rate of the patient. So to calculate heart rate or the ventricular rate is, because heart rate we consider only when the ventricle pumps, left ventricle pumps, right ventricle pumps, and that pumping rate is called, what we call it as heart rate. So it's very simple to calculate. These are the two small box. These are the two large boxes. This is the two large box. This and this, and one small box and one small box, means almost 2.5. So around 2.5 small boxes are there. Uh, so the simple calculation rate is 300 divided by number of large boxes. So 300 divided by 2.5. This is the ventricular rate, and it turns out to be around 300 divided by 2.4 or 2.5 is 125. So the ventricular heart rate is around 125 or 124. Now we'll calculate the atrial rate. Atrial rate. So to calculate the atrial rate, we have to simply see how many boxes are there in between the two P waves. So this is one small box, large small box, 2, 3, 4, 5. So either you can calculate 300 divided by 1 or around 1.2 large boxes, or you can simply calculate it by 1500 divided by total number of small boxes, which is around 6. We'll again do that. This is the P, this is the P, this is one small, 2, 3, 4, 5 and 6. So there are 6 small boxes, means around 1.2 large box. So 300 divided by 1.2 is 250, or 1500 divided by 6 is 250. So the atrial rate is 250 and the ventricular rate is 125, means it is exactly half of the atrial rate. You can again see, notice, this is the P wave, this is the P wave, this is the P wave, this is the P wave. They have same morphologies. The P waves are embedded here. So this is the P wave, this is the P wave. It is everywhere same pattern is there. P wave is there, P wave is there. You can very easily notice this is the P wave, this is the P wave. So atrial rate is 250 and the ventricular rate is 125, exactly half. So this is a very typical case of atrial flutter, which we call it as atrial flutter with 2:1 block, because after every for every two atrial impulses there is one ventricular impulse. For flutter we can very nicely make out sawtooth appearance, sawtooth of appearance, and we can see it here. So this is typical sawtooth. You can simply search image of sawtooth on Google and you can see the sawtooth, which is the same. So this is just a very typical sawtooth appearance with atrial flutter waves. These are called flutter waves with 2:1 block, and that's all.